Hello, my name is Shamara Coates. I am Brody's caseworker and I'm going to attempt to diagnose him. So, Brody cannot be told what to do. He is this 15-year-old single mother has come to me for answers about what she terms as above and beyond normal teenage disobedience. School assessments demonstrate that Brody's intellectual abilities are somewhat above average, but his grades suffer due to his tendency to become annoyed and pick arguments with his teachers and other school staff members. Brody's mom indicates that he has no history of drug use and only been in trouble within the academic setting. But she worries his argumentative nature will land him in greater difficulty as he continues through high school. So, in order to properly diagnose Brody, I would like to ask Brody's mom some additional questions such as, is there any aggression being displayed? Is Brody hostile? Does Brody blame others for his issues? How often does these issues arise? What strategies have been implemented to fix the problem? Okay, so next let's look at Brody's age. He's an adolescent, 15 years old. Adolescence is a phase of life between childhood and adulthood. This stage ranges between ages 10 and 19 years old. It's a unique stage in human development because you experience rapid physical, cognitive, and psychosocial growth. Studies show that 15.2% of adolescents doesn't listen well to others. So let's explore ODD. It is short for oppositional defiance disorder. It can be defined as a pattern of negative, defiant, disobedient, and hostile behaviors toward authority figures that last for more than 6 months in length. The category of this disorder would be disorders in children. For a child to be diagnosed with oppositional defiance disorder, there must be a group of symptoms that are presently displayed within the child in question. These symptoms include, but are not limited to, frequent loss of temper, argumentative, always blaming others, and failure to comply with rules, which we see all of those in Brody. These behaviors are displayed constantly and must impair the child's educational or learning process and overall adolescent functioning in order to be giving this diagnosis. ODD affects anywhere between 2 up to 16% of school children. It is a difficult disorder to deal with as a parent or educator who cares for the child who is constantly defiant and not wanting to listen to anything that you may say. School is where a child is supposed to learn the necessary skills to prepare for a sustainable future, but a child with ODD will have a difficult time at school. Brody's mom did indicate that there was no history of drug use, and he only has this issue in the academic setting, but his argumentative ways may lead him into a bad situation. ODD children are often disruptive in that they distract other children in the classroom setting, affecting everyone and themselves academically. Teachers said that they feel they have no other option but to expel them from school because the schools are poorly equipped to handle kids who have behavioral issues, and there's no other alternative programs to address the problem. So more than likely, if he doesn't get these behaviors under control, things will get worse. Research studies showed that each children that is expelled from school has a higher chance of eventually becoming connected to gangs, developing substance use disorder, or falling into the school for prison pipeline. I think Brody can possibly have a very mild case of ODD. Unfortunately, medications alone generally isn't used to treat ODD, so that would not be an option for him. There is no single cause for ODD, so researchers do theorize that some children develop the symptoms of ODD to cope with anxiety and persistent feelings of uncertainty. Brody is in his adolescent years, which is a very difficult and trying time for all parents to deal with children in that age gap. And many experts and researchers believe that children that have a negative relationship with one of their parents is more than likely to have this disorder. What I would recommend is social skill training for Brody. I think he may benefit from therapy. That may help him become more flexible in learning how to deal and interact with other more positive and in a more positive and effective way with adults in the academic setting. School assessments demonstrate that Brody's intellectual abilities are somewhat above average, so he has the ability to learn and implement changes. I will explore other opportunities if these options doesn't work for him, but for right now, that is what I recommend.